You woke up that morning feeling fine. Nothing dramatic. Nothing that screamed emergency. You made your coffee. You sat in your chair. You watched the news. But something small was off. Your left shoulder felt tight. Not painful. Just tight. You thought it was from sleeping wrong. You went back to bed early that night. 3 days later, you were in the emergency room. And the cardiologist looked at you and said, "Your body was warning you for 2 weeks. You just didn't know what you were looking at." That is exactly why I made this video. Because a heart attack does not show up like it does in the movies. There's no dramatic clutching of the chest. No falling to the floor. Not always. Sometimes it is a feeling you brush off at breakfast. Sometimes it is a symptom you Google for 30 seconds and forget about. And sometimes it is the thing that happened to a patient of mine in Scottsdale, Arizona. A 64-year-old retired teacher named Gerald, who came into my clinic after his wife made him come in. He said he felt fine. He looked fine. But his body had been sending warning signals for 14 days straight. We caught it in time, not everyone does. So today I want to walk you through the signs your body sends in at least 2 weeks before a cardiac event. These are not rare symptoms. They are not dramatic. That is exactly what makes them dangerous. And by the end of this video, you are going to know exactly what to look for and when to make that call. Stay with me. Because what I'm about to tell you in the next few minutes could be the most important thing you hear this year. Let's start with fatigue. Not the kind where you worked all day in the yard and need a nap. I mean bone-level exhaustion that does not match your activity. You sleep 8 hours. You wake up tired. You sit down for 20 minutes and feel like you ran a mile. You try to climb your stairs and have to stop halfway. I have seen this pattern in hundreds of patients. Many of them tell me the same thing. I thought I was just getting older. And I understand that. When you are over 60, fatigue feels like a normal part of life. But here's what most people do not realize. When your heart muscle starts to struggle, when blood is not pumping efficiently, your entire body gets less oxygen, and your body responds by diverting that oxygen to your most critical organs. Your brain, your lungs, your kidneys. Everything else gets less. That means your muscles feel heavy. Your thinking feels foggy. You feel completely wiped out even on a rest day. This is not laziness. This is your heart working overtime just to keep up. Many of my patients in Florida and Arizona describe it as feeling like they have the flu coming on, but the flu never arrives. Just that heavy, dull exhaustion sitting on their chest for days. Write this down. Unexplained fatigue lasting more than 3 days is worth a conversation with your doctor, especially if it came on without a clear reason. Now, let's talk about something that surprises most people. Jaw pain, not tooth pain, not a cavity, but a dull aching pressure along your jaw, your neck, or your left shoulder. I know that sounds strange. Why would your heart affect your jaw? Here's the reason. The nerves that receive pain signals from your heart travel through the same pathways as the nerves in your jaw and your left arm. Your brain sometimes gets the location wrong. It thinks the pain is coming from your jaw or your shoulder, when it is actually originating from your heart muscle. Doctors call this referred pain, and it is one of the most commonly missed signs of a cardiac event, especially in women over 60. Here's what to look for. The jaw discomfort may come and go. It might feel worse when you are walking or doing mild activity. It might ease when you sit down and rest. That pattern of coming and going with activity is a significant signal. Gerald, the patient I mentioned earlier, he had jaw tightness for 10 days before his event. He told his dentist. His dentist said his teeth looked fine. And both of them moved on. I am not blaming the dentist. I am telling you this because it is easy to miss. If your jaw aches for no dental reason, especially combined with any other symptom in this video, that is critical. Do not wait on that. Let's keep going, because the next one catches people off guard. Sleep disturbances. Specifically, waking up in the night with a racing heart, mild shortness of breath, or a strange sense of anxiousness, even when your day was calm. Now, I know many people over 50 have trouble sleeping. That is common. But there is a specific pattern connected to cardiac stress that is different. You fall asleep fine, then somewhere between 1 and 3 in the morning you wake up. Your heart feels like it is beating harder than normal. Not fast necessarily, just hard. Like you can feel it in your chest, sometimes in your throat. You sit up. After a minute or two it passes. You think it was a dream, but it happens again 2 nights later. Here is what is likely going on. When you lie flat, your heart has to work against gravity differently. Blood redistribution changes. If your heart is under stress, it may struggle more in certain positions. Your nervous system responds by triggering wakefulness, essentially an alarm system designed to protect you. That midnight wakefulness is your body pulling you out of deep sleep because something needs attention. If this has been happening repeatedly over the past 1 to 2 weeks, do not ignore it. Mention it at your next appointment. Better yet, call and mention it now. Here's something I want you to actually do right now, or when you finish this video. Look at your ankles. Just look. Press your finger firmly into the skin, just above your ankle bone. Hold it for 5 seconds. Release. Does the dent stay? Does the skin take a few seconds to spring back? That is called pitting edema, and it can be an early sign that your heart is not pumping efficiently enough to clear fluid from your lower body. Now, swollen ankles can happen for many reasons. Standing too long, heat, certain medications, including some common blood pressure drugs available at CVS or Walgreens. So, swelling alone is not automatically cardiac. But here's the combination that matters. Swelling plus unusual fatigue. Swelling plus shortness of breath when you lie down. Swelling that gets notably worse by the end of the day, every day for more than a week. That combination is not something to wait on. Many of my patients ask me about over-the-counter water pills they find at Walmart or Costco. And I understand the instinct, but please hear this clearly. If your body is retaining fluid because your heart is struggling, a supplement is not the right first move. A phone call to your doctor is. Now I want to talk about something that sounds almost too simple. Indigestion, or what feels like indigestion. A persistent burning, pressure, or discomfort in the center of your chest or your upper abdomen. You took your antacid. Maybe it helped a little, but it keeps coming back for days, even when you have not eaten anything that would normally cause it. This is critical, and here is why. The diaphragm sits right next to the heart. When cardiac tissue is under stress or oxygen deprived, it can trigger irritation in the surrounding tissue, and your brain registers that as a stomach issue. Many patients describe it as acid reflux that just will not go away. I have had patients who took Tums for a week before coming in. They were convinced it was something they ate. It was not. Here's the pattern to watch. Here's the if your indigestion does not respond to antacids the way it normally would. If it gets worse with physical activity. If it is accompanied by sweating or lightheadedness. That is not your stomach. Have you been brushing off any of these symptoms? Because here is what most people do not realize. It is rarely just one of these signs. It is usually 2 or 3 of them showing up quietly at the same time. And that combination is the real signal. Let's talk about breathing next. Not the kind of breathlessness that happens after exercise. I am talking about catching yourself short of breath, doing things that should be easy, putting on your shoes, washing the dishes, walking from the bedroom to the kitchen. You stop. You take a breath. You continue. Most people chalk this up to being out of shape, and maybe for some people that is true. But when this pattern appears suddenly, meaning it was not there 3 weeks ago, but it is here now, your heart deserves attention. What is happening is this. When the heart is not pumping with full strength, fluid can gradually back up into the lungs. Not enough to cause a medical emergency right away. Just enough to make your lungs feel slightly full, like you cannot quite get a complete breath. Doctors call this early pulmonary congestion, and it often develops silently over 1 to 2 weeks before becoming severe. A few of my patients in Phoenix told me they thought they were just tired during allergy season. Their breathlessness felt mild, easy to explain away. Please do not explain it away. One clear test you can do at home. Lie flat on your back. If you immediately feel like you need to sit up or prop yourself on pillows to breathe comfortably, that symptom has a name. It is called orthopnea, and if that is new for you, call your doctor that day. Now, I want to spend a moment on anxiety, because this one gets missed constantly. A sudden feeling of unease, like something is wrong, but you cannot name what it is. Some patients describe it as a sense of dread. Others say they felt nervous for no reason. Others say they just felt off, like their body was quietly alarmed about something their mind could not identify. This is not weakness. This is not overthinking. This is your autonomic nervous system, the same system that controls your heart rate and blood pressure, sending a signal through your emotional experience. Your body knows something before you do. A woman I treated in Tucson told me she sat on her porch for 3 hours the week before her cardiac event, feeling inexplicably anxious. She had no history of anxiety. She had no reason to be stressed. She told her daughter about it. They both thought it was hormonal. When you combine unexplained anxiety with any 2 other symptoms from this video, your body is asking for attention. I want to spend a moment on numbers, because numbers do not lie. If you have a blood pressure monitor at home, and I strongly recommend one, the upper arm cuff style is most accurate, available at Target, Walgreens, or Amazon for under $30. Check it right now. Normal is below 120/80. If you are consistently seeing readings above 140/90, your heart is working under pressure. Literally. But here is something just as important that often gets overlooked. Low blood pressure can also be a warning sign in the 2 weeks before a cardiac event. If you are someone who normally runs 130/80, and now you are seeing 105/65, and you feel dizzy when you stand up, that drop matters. It may mean your heart's output is decreasing. Track your readings morning and evening for 3 days. Write them down. If you see a pattern that is unusual for you, higher than normal or lower than normal, bring that log to your doctor. Under the Affordable Care Act and most Medicare Advantage plans, a preventive heart health visit is covered. You should not need to wait for a problem to get bigger before you can afford to address it. Now, I want to talk about what to do. Because the worst thing after hearing all of this is to feel overwhelmed. That is not why I made this video. Here is what I want you to do today. First, take inventory. Spend 2 minutes and think honestly about whether any of these symptoms have been present in the last 1 to 2 weeks. Not just one. Look for 2 or more showing up in the same window of time. Second, check your ankles. Do the press test I described. Look honestly. If you see pitting, note it. Third, measure your blood pressure. Twice. Morning and evening. Write down both numbers. Fourth, if you have 2 or more symptoms from this video, fatigue, jaw discomfort, sleep disruption, swelling, breathlessness, unusual anxiety, or that sense of dread, call your doctor today. Not next week. Today. And fifth, if you experience any of the following, do not call your doctor. Call 911. Sudden severe chest pressure or pain. Pain spreading into your left arm. Sudden extreme shortness of breath. Sudden cold sweat with nausea. Sudden lightheadedness or loss of consciousness. These are the emergency signals. Everything else in this video is the early warning. Everything I just listed is the active emergency. Know the difference. And do not let pride or embarrassment delay you calling for help. Here is what I want you to walk away with today. A heart attack is not a single moment. It is a process. And that process almost always sends signals in the weeks before it reaches its peak. Your body is not trying to deceive you. It is trying to communicate with you. The problem is that the signals are quiet. They are easy to explain away. They look like aging. They look like stress. They look like a bad sleep week. But 2 or 3 of them together, over the course of 1 or 2 weeks, in a person over 60, that is your body being serious with you. I have been doing this long enough to know that the patients who do best are not the ones who had the mildest symptoms. They are the ones who paid attention early. You now know what to look for. You have the tools to check, and you know when to make the call. Do not wait for it to get louder. Listen now. If this video helped you, there's another one linked here that covers the 5 blood pressure numbers that your doctor checks but rarely explains to you. A lot of patients tell me that video changed how they manage their heart health daily. It is worth your time. And if you know someone over 60, a spouse, a sibling, a neighbor who has been complaining about being tired lately, share this with them today. You might be sharing something more important than you realize. Take care of your heart. It has been taking care of you for a long time.